Start off by telling me what the general situation is of COVID-19 across the continent.
The COVID situation on the continent and specifically in the WHO African region, which is sub-Saharan African countries and Algeria, is cause for concern, really. In the region, we have now over 270,000 cases reported since we started seeing cases here late in February. And we're seeing a continuing growth of the pandemic overall and an accelerated growth in a number of countries. So, as you know, we have 47 countries, and the situation is not the same all over the region. For example, South Africa is the country which has the largest number of cases, and in fact, at the moment, has about 2/3 of new cases in the region. So it's in countries like South Africa, Nigeria, that we are seeing continuing growth and acceleration, really, of the situation. And then we have other countries like Ghana, Cote d'Ivoire, Chad, where we are seeing community growth, meaning the cases were initially imported. Now they've gone beyond clusters around a family or a group that's associated, and there is transmission in the community which cannot necessarily be traced to a person. We've also seen that about 5 countries account for over 80% of the deaths, and that is countries like South Africa, Nigeria, Ethiopia, and Algeria. We do have, I think it's important to stress that we do have some countries that have had a serious situation and then have managed to slow it down, like in Cameroon, for example, countries like Burkina Faso and Niger, where we're seeing really a decrease in the daily number of cases. At the moment, we're having about 6,000 or over 6,000 new cases reported, and that's higher, much higher than we've had in the past, but is clustered in a few countries.
Given that most of the cases, as you say, in sub-Saharan Africa are in a small number of countries like Ethiopia and South Africa, do you think that gives cause for hope that COVID-19 has not had the devastating impact that was predicted at first in Africa?
Yes, it does. Although it does give hope, but I think we need to be vigilant and the countries need to continue to put in place the measures that are warranted. With the types of projections of a dreadful situation with many, many people infected and dying have not come to pass, partly because the governments did two things. First, there already had been some capacities built in preparation for other outbreaks. You know, African countries frequently experience outbreaks, and particularly in relation to the Ebola outbreak in the Eastern Democratic Republic of the Congo. Countries had put in place some measures like point of entry screening. This was being done virtually throughout the region, and they had started improving their testing capacity. One of the things that we believe made the biggest difference is that governments took the decision quite early on to put in place the social and physical distancing measures, stopping people moving around, getting people to stay at home, which was very difficult for many people in the African context, and also promoting some of the measures like hand washing, etc. These, we believe, slowed down the spread of the pandemic. But of course, we know that they've had an impact on the economies, not only the economy of the country, but very much livelihoods of the population. We have a large proportion of people in Africa who earn their living in the informal sector on a day-to-day basis. And I think the measures have been very tough for many families, but they did have this effect of slowing down the spread. Countries now are under pressure to open up their economies, as is happening all over the world. And we have started to see in a few countries an increase in cases since this happened. So we have a number of countries, for example, like Mauritania, the Central African Republic, where the cases that were seen before the beginning of May were much fewer, and in general, the release of the lockdown measures started to happen during May and is happening now in June. And we are seeing in some countries an increase of cases. That means governments need to continue to scale up their basic public health intervention capacity, meaning to be able to test people, identify the cases, identify their contacts, and then isolate these people. make sure that the facilities are there to safely isolate people so that we cut the spread. So I would say overall, we've been very encouraged by that. The trend has not been what was predicted. We have seen a severe situation in a number of countries, and I've cited South Africa is one of them. The strong measures slow down the spread. Now we need to see public health measures being scaled up, testing particularly, and isolation, and continue to be vigilant. I think we can't be celebrating yet, but we are hopeful because of the pattern that we've seen, which was not as we had expected.
Do you think going forward that one of the things that puts a lot of African countries at risk is that compared to other parts of the world, their health infrastructure is not as strong in dealing with cases in the future? Do you think that's a danger for Africa compared to the rest of the world?
Yes, it is a great concern because the capacity of the health system in most of our countries would not be able to cope with a huge increase in people needing treatment and care, particularly people who would be getting seriously ill. So we would like very much to emphasize then the need to stop the situation becoming that severe, to be able to treat patients, to be able to provide not only treatment of the mild cases, but particularly treat people who have severe illness, those who need oxygen. Even the oxygen supply is not sufficient in the region, particularly beyond the capitals. So if you go into the hinterland, into the districts and provinces in countries, the capacity of our health systems is very, very inadequate. And if people need intensive care, those who might need to be put on a ventilator, I think the situation is really not up to having large numbers of cases. That is why we're stressing so much now the role of the community over and above the public health measures. We really would like people to be knowledgeable about the problem, to be enabled to prevent transmission, emphasizing very much the wearing of masks when people are moving around in public and basic hand hygiene so that they're not moving the virus around as they touch surfaces in public places, then return it home. But indeed, our health systems would be overwhelmed if we saw large numbers of people infected and ill.
Dr. Moeti, thank you very much indeed.
Thanks very much.